This past week, testing for Covid-19, or the lack of it, has been the main focus of criticism of the government's handling of the pandemic. A report by the Adam Smith Institute found that the early decision by health authorities to centralise testing to a single Public Health England laboratory has hampered the ability to increase testing in the UK. Additional PHE and NHS laboratory resources were added, and latterly university and private sector operators have been utilised, but the UK is still carrying out fewer tests than comparable countries like Germany and the USA, for example. But should we be a little bit more wary about the idea that more testing automatically means better testing? And should we also be a bit more concerned about what the implications of mass testing could be? In particular, what will government and authorities do with this test data? Joining me to discuss is the IEA's Head of Regulatory Affairs, Victoria Hewson, and Matthew Lesh, Head of Research at the Adam Smith Institute and the author of their report on COVID-19 testing in the UK. Hello to both of you.
Hello.
How are you doing?
Hi, Darren.
Is
Very well.
COVID-19, is being in lockdown driving you absolutely mad yet?
I mean, as my colleagues will know, I love working from home, so I might be in a bit of a weird position here of enjoying it. But I would like to be able to go out for a drink.
Yes.
And
That's
it would be nice to socialise every once in a while at least.
Yeah. Anyway,
I cannot wait for the pubs to open.
Exactly. It's the pubs that are the problem. Matthew, I wonder if we can start by you explaining what the main findings of your report.
So the report really looked at the structural decisions that were made about testing in the UK from the early days. Basically, the approach of the UK was to very much centralise testing, to control testing in the hands of Public Health England. Best we can tell, basically Public Health England had a little bit of infrastructure in place to deal with pandemics. When this came, they said, let's activate. This has been sitting there ready to go. We'll use what we have. But as a result of that, they were quite slow to expand that out. Firstly, to the entire network of Public Health England laboratories, and then the NHS. And only now are we starting to see them talk about. They haven't actually activated any non-government testing facilities. And there's even still a lot of skepticism about people who are offering to do testing for the government. Now, the report seeks to contrast this to the likes of South Korea, to Germany, that from very early on had a very decentralized approach where they invited companies in to be part of the process. South Korea in January got companies together, said, can you please develop testing processes? Can you please make sure that we can scale this up? Germany just kind of by default has a very decentralized system of government and system of healthcare. So they were able to activate a lot of different public and private testing capacity. The UK effectively made an active decision until about last week to not involve anyone else in the testing process, despite the fact that the UK does have world-leading diagnostics companies, world-leading pharma companies that can repurpose for diagnostics some of the machinery, because they're doing what is more or less a kind of standard test when it comes to the COVID patients. That is also partly responsible for the fact that we don't have all the reagents we need, all the materials we need, because we didn't build up capacity from early on. And then we subsequently saw that there were quite substantial global shortages. And also, and even this has been a continuing issue, is this relative restriction in the type of tests that they're allowed to do. Now, more or less, the US followed the UK approach to begin with as well. They very much centralized testing in the hands of the CDC. That all changed in about mid-March when the FDA decided that they were going to let private sector do testing. And since then, we've seen literally hundreds of thousands of tests. Their testing capacity has grown by 21 times between the middle of March and end of March, while the UK capacity only about doubled. So you can just see by activating more people, by getting the entrepreneurs and the innovators right across the scientific sector in the UK and asking them to help, you can achieve quite a lot. What was the most striking was this emerging reality that a lot of people had offered to do testing and the government just hadn't gone back to them. Public Health England hadn't used these people who were putting themselves forward. And this is some of the top scientific researchers in the world. Some of the top most capable people in the world who want to do testing, who want to help and haven't been allowed to as yet.
I mean, Victoria, Matthew's surely right, isn't it? It's incontestable that Public Health England and the NHS got some decisions badly wrong in their approach to testing. And this is perhaps a wider reflection on centralised bureaucracy than it is on our scientific advice in this country. Now, this decentralisation as called for in Matthew's report, that is obviously a sensible step, isn't it?
Yes, it is, and everything that Matthew has just said, as you say, is pretty much incontestable. The issues that I was raising in the blog that's on the IEA website this week is that that's kind of only half the story, and it's a very, very important. I mean, it's vital, it's pivotal to have the amount of tests. But the other half of the question is what are you testing for? As in, why are you testing? And what are you going to do with the data and the results of all of these tests? And there's an obvious answer. One is you use test results to decide how to treat individual patients based on whether they have or haven't got the virus. And then obviously there's a very strong case for testing key workers, especially NHS workers, who perhaps have shown some symptoms, or their family members or people in their household have shown some symptoms, and they're essentially being taken out of the workforce because they're self-isolating at home for very good reason. However, a lot of them will not actually have the virus. So if you can test those people and they test negative, they can get back into the workforce. And then obviously the more information we have about the spread of the virus at an epidemiological level, the better it is for figuring out the models and ultimately how the virus works and an exit strategy out of it. But where I have some concerns, and where I think possibly in the tumult that we are witnessing in press conferences, etc., where journalists are very anxious just to throw numbers and challenges and targets around at politicians, especially the Health Secretary, Matt Hancock, is that we're not really then thinking through what wider or rather what very specific uses testing data might have as an exit strategy. And people are talking about track and trace as being a way of really getting the epidemic under control, so that people who are tested positive you can trace everyone who they've been in proximity with, and both the person who tested positive and all of their contacts and people they've been in close proximity to can be tracked down, and everybody will then go into quarantine. And that can really have very exponential effects on cracking down the spread of the virus. But there's huge downsides to that in terms of civil liberties and the amount of potential surveillance that entails by government, and in fact also by people in the neighbourhood generally. And we've already seen how keen the British people have been to go around snitching on their neighbours and calling the police for people sitting in the park. Can you imagine how the great curtain twitchers would get on if there were apps around that were publicising the movements of people who had tested positive for the virus?
Matthew, do you agree with that? Do you think there are or should be more concerns about the implications of this mass testing, in particular what government and authorities actually do with the test data, but the way in which you actually go about real-time track and trace, as we've seen in other countries like South Korea, for example?
Yeah, so I think the first element here is just acknowledging where we are when it comes to testing right now. Because of the kind of previous failure that obviously we can't undo, we're not actually trying to do track and tracing at all in the UK. Currently, testing is very much restricted to current patients, and they're trying to expand that to the NHS. And then you get a few VIPs who are able to access testing here and there. So what I would have liked to have seen happen in the past, and what Public Health England tried to do but ultimately failed to do, was more or less that track and tracing. And I think that was actually probably in some ways effective, at least before you had a giant probably inflow of people from the rest of Europe into the UK with cases, was quite effective in terms of slowing the spread. And we've seen that in South Korea. It was extremely effective in stopping any kind of major outbreak. By identifying, as Victoria is discussing, identifying people who have it and then identifying people that have been near. Now, you can take this too far. I think that's completely right, as Victoria said, that there are implications with civil liberties when you start tracking and tracing your entire population. I've heard the analysis put forward that perhaps we've lived in a unique last 100 years of time when we've actually been able to be anonymous in cities. And any time before that, basically everyone in our community a tiny community watched where we were. And in the future, we're just going to be watched by government all the time. I think that's quite dystopian. And I actually, at the same time, I don't think it's necessary. So I think there are some technological solutions here to track and tracing that can preserve our privacy whilst at the same time achieving the goals we need to achieve. For example, we've got this new initiative dubbed PEP-PT, so it's called the Pan-European Privacy Preserving Proximity Tracing. But this group is a group of software engineers who've already developed a piece of software that what it'll do is you can install it on your phone. It'll use Bluetooth to track who's been near you, but it does so anonymously, securely. This data isn't held by government. It's kind of held anonymously in the cloud on your device, so we know who you've been near. And then if within the next few weeks, someone who you've been near is confirmed as a case, it gives you a notification. But importantly here, and I think this is absolutely key, is it's not about the health authorities having this data and identifying you and having your name and then knocking on your door. It's something that could be actually both privacy protecting and liberty protecting, in the sense that this would be an information tool rather than an enforcement tool. Now, personally, I would be willing to accept more, totalitarian methods that potentially do undermine our privacy, if that actually meant that we could stop this virus and we could move from what I think even more totalitarian methods, which is this broader style lockdown that we're currently seeing. I think it is key for our liberty to move from this broad style lockdown to more targeted methods. But at the same time, if we can square the circle, we can do that technologically without necessarily hurting people's privacy. I think that's probably the ideal place we want to end up.
I mean, Victoria, before I bring you back in, Matthew, is there not a slight "the grass is always greener on the other side" effect at play here in referencing the likes of Germany? Because so far, carrying out testing doesn't actually appear to be, if you look at specialists in Germany who are arguing for more intelligent testing, now that seems to mean a targeted approach that would allow testing to determine the best treatment for those who present with symptoms.
Oh, no. So what the German specialists have talked about is basically because they have so much testing in Germany, that some people are getting testing who aren't showing symptoms. So it's probably saying that we should be more focused on testing, but that's not saying that they should necessarily take the UK approach, which is to give up on tracing and tracking. Once you have the capacity, you're going to want to be able to test people in the community. And I think there's a lot of people out there who do wish they could be tested and wish they could have that information. And then we could potentially even just ask people to contact people they've been in touch with, do that contact tracing voluntarily. Right now, we don't have that capacity at all, which we're going to have to build. I think everyone kind of acknowledges that we're going to have to build that. And then it's a question about how we do it and how quickly we can do it. And I'd also just make one more point about Germany. We don't know yet. You're right. We don't know yet whether or not the grass is really green, whether or not Germany will deal with this virus better than the UK. And the analysis could end up being completely wrong. What it does look like Germany has managed to do so far is slow down the pace of infections, particularly compared to France or Italy or Spain. We know that. We don't know where their peak is going to be. It does appear to have slowed down in a few days ago. Now it's gone back up a little bit. We're not quite there at the knowledge point about who's achieved the most, Germany or the UK. I think if we compare to some of the more democratic countries in East Asia, we can probably see a little bit more success. I think they've probably gone quite extreme, though, of course, with their contact tracing, even more so than Germany, a country like South Korea or Singapore or even Hong Kong.
Speaking of South Korea, Victoria, if you look at the kind of track and trace approach that has been deployed in South Korea, and actually you write about one location in Italy with some success, wouldn't we actually want to stop the spread of this deadly virus that's destroying our economy, lives and livelihoods? And if we can replicate that here, as Matthew says, surely that's a thoroughly good thing, isn't it? And to be endorsed.
Well, of course, stopping the virus is vitally important, and getting our economy going again is vitally important. But I'll just read out a description of the South Korean approach. That's from the scientific journal Nature. When a person tests positive, their city or district might send out an alert to people living nearby about their movements before being diagnosed. A typical alert can contain the infected person's age and gender, a detailed log of their movements down to the minute, in some cases traced using closed-circuit television, credit card transactions, the time and names of businesses they visited. In some districts, public information includes which rooms of a building the person was in, when they visited the toilet, and whether or not they wore a mask. Even overnight stays at love motels have been noted. So you can see that this stuff is really very intrusive. And in the UK, we're already extremely heavily surveilled by closed-circuit television. So there's vast resources available to the state to deploy in this kind of surveillance. But the implications, once the genie's out the bottle and the state and health authorities have these technologies at their disposal, for one, there's a strong slippery slope risk if it's so successful for counteracting the coronavirus. Why not use it for other public health priorities as well, like, I don't know, enforcing vaccinations on children or preventing obese people from going to sweet shops, these kinds of things. You know, Public Health England is in fact historically been much more concerned about those kinds of things.
And the World Health Organization, indeed.
Yes, exactly. And I think where we should really be seeking to strike this trade-off is perhaps not at asking the question, do we want to make these trade-offs on our privacy and civil liberties and inviting state surveillance of our health data and everyone we come into contact with as a trade-off, as a way of getting out of the lockdown? In fact, the question should be posed, it should be one of the costs of the lockdown. So if the Prime Minister had said to us 3 weeks or so ago, we're going to have to close all the pubs and put all of these measures in place, and nobody's allowed to leave their home without reasonable excuse, and the police will have powers to enforce all of that. And by the way, we'll probably only be able to lift that if you all agree to give us your health data and allow us to surveil your every movement, door to door, and everyone you come into contact with. I suspect there might have been a bit more resistance in Parliament and in society more generally to actually instituting the lockdown in the first place if it had been known then that that would be the cost associated with getting out of it again. And let's not forget as well, there will be populations in this country who will be very resistant. And I don't just mean libertarians and contrarians. I'm talking about undocumented immigrants who will just not wish to participate in this kind of program and possibly won't be able to anyway because they fall outside of healthcare provision and that kind of thing. Nationalist communities in Northern Ireland who historically have been very resistant to any kind of tracking of their movements, or in fact in many ways don't really accept that the state has much of a role to play in their lives. The British state has much of a role to play in their lives at all. So already we can see there will be people who would react very strongly against this kind of thing being mandatory. Now I accept Matthew's description of tools out there that will not be mandatory, that will be voluntary, and will just get a lot of data out there to be socialized and help people make decisions about what to do. But what I can see as well is that even if these kinds of apps are deployed on a purely voluntary basis, so the police won't demand to see the app and you won't have to show the app to be allowed to go to onto the tube or something like that on public transport, you can easily foresee that even if these kinds of technology solutions are voluntary, businesses will use them. Employers will ask to see people's immunity status. Pub owners and shop owners will ask to see your immunity status before you'll be allowed in. So there are lots of issues here that need to be considered, even in the sense of a voluntary tool.
Absolutely. I mean, Matthew, we're running short of time. I'm conscious of the time, but there have been suggestions of a wristband system or an immunity passport, however way you display your immunity and your sort of godlike status in society, could be issued that allow immune people to be exempted, as Victoria just touched on, and you touched on it earlier as well, from lockdown measures. The incentives that this would potentially give rise to, right, could be pretty troubling for individual freedom, right?
Yeah, so I just want to
drawbacks there?
I just want to quickly respond to some of the points Victoria made, and then I'll come back around to that. Quick. So I think firstly, any measures have to be temporary, have to be proportionate, and have to have expiry dates. And I know the danger is that they don't, but I think we have to make that point repeatedly. Secondly, I don't think we actually have the state capacity to replicate what South Korea is doing, even if we wanted to. I think we're inevitably going to have to use more simplistic, in some ways, more technologically complex, but in terms of less human-intensive solutions, because the number of cases we've had in the UK, the extent of the outbreak, unfortunately, we're long past the point where we could do what South Korea is doing in the sense of it being a relatively small outbreak where they've identified cases and dealt with them. Thirdly, just on this calculation consideration, I mean, in my head, I'm kind of applying a JS Million kind of harm principle here, which is to say you are actively harming others if you go around with this virus, and therefore there is some justification to restrict liberties to protect the whole. I think that's what we're doing today in the lockdown. And I think if we can take measures that take away the lockdown, even though they might not be less than ideal when it comes to liberty restrictions, I think that is a net gain for liberty and a net gain for society and public health, which probably links us back around to this kind of immunity passport situation. I think you're right that there are some serious conceptual issues with it when it comes to people perhaps seeking out the virus to get this immunity and the way it will be used in society. And that's why we probably need a mixture of methods. And we probably have to be very careful about the fact that those immunity passports will expire as soon as there's a vaccine, limit the extent to which they can be used in a discriminatory manner if we're going to have them. But I suspect we'd have to take those steps anyway, because once we have the antibody tests, which hopefully will be coming sometime soon, although it might just be a theoretical argument if we can't get those at-home antibody tests quite right, we will have to think about the implications of this more broadly and the way they're used.
Yeah, I mean, Victoria, do you want to quickly come back on any of that?
No, I think I would just really close by saying I'm certainly not anti-testing, and I'm not anti-innovative technology tools being used to fight this virus. In fact, it's absolutely vital that they are. But we need to have a very transparent debate about what these tools should be and how they should be used. And there needs to be a lot more scrutiny, I think, of the possibilities that these tools present, both positive and negative, before we simply fall behind the Minister of Testing deciding what to do with all of this power that essentially is going to be available to the government.
Well, yes, I mean, thinking of those wider repercussions and what our policymakers will be deciding over the coming weeks, I wonder if I can ask you both to end, and I'll start with you, Matthew. Do you think there needs to be a discussion similar to the one that we're having right now, a frank discussion that scrutinises with a genuine commitment to minimising the negative impact on things like civil liberties and the wider economy? Because it strikes me that if you look on social media today, you mentioned them earlier, one of you mentioned them earlier, the sort of curtain twitchers who are willing and ready to report people for being out in a park, for example. But if you so much as mention that the government should be considering our exit from the coronavirus lockdown, you're considered to have committed some heinous act of treachery or heresy. I mean, I wonder, do you think we need to get into a position where we can actually have this debate?
I think as soon as we got into this lockdown, quite frankly, we needed the government to start developing a strategy to get out of it. It is extremely damaging to society. People dismiss economic growth as some arbitrary GDP figure, and in the short run, clearly would prioritize public health. But for all of our health, for our prosperity, for people having jobs, people having incomes, of people having longer lives, GDP growth is absolutely key, and that's something we need to be able to get back to prioritizing, there are trade-offs. We can't keep in saying that, I'm putting public health above the economy. The economy is public health and public health is the economy. They're not, they're interchangeable, they're interrelated, they're the same thing. And if we just keep in place a lockdown indefinitely, we're going to completely stab ourselves in the foot. And what I really do worry about is the impetus on government to always do something, to do more extreme steps. Even when the existing steps appear to be working, when we appear to be plateauing out in terms of the death numbers and hospital admissions, at least in London, the impetus that people are doing something wrong, or they're not acting appropriately by sunbathing for 20 minutes nowhere near anyone else on a park lawn or bench. I mean, we've got this kind of mini kind of authoritarian sentiment coming out that I think is quite concerning when it comes to this lockdown. And even though I'm personally quite supportive of it, even the extent of support I find almost frightening. We do need some skepticism when the government seeks to expand power. And I think eventually this will come out quite forthright.
Yeah. Victoria, when do you think that'll happen? When do you think that will be? When will we be able to have this conversation?
Well, it's interesting. In the past week or so, again, it's been reported now, to what extent this is just political gossip, that there was some kind of rift between the Chancellor of the Exchequer and the Health Secretary about an exit strategy. And Rishi Sunak was accused of seeking to prioritise the economy over people's health and actually trying to beat the virus. But as Matthew very correctly pointed out, the economy is absolutely vital to people's future health and well-being. So that's really a false dichotomy. And I think the same applies to this question of testing. Getting the testing right isn't separate to the exit strategy. Getting the testing right will be the exit strategy. And that's why we need to be very, very clear on what actions and steps will result from the testing data as and when it arises, and we get a proper grip on carrying out enough tests in the right places amongst the right people.
Yeah, well, that brings us to the end. So thank you very much to both Matthew Lesh and Victoria Hewson for joining the IEA today. Don't forget, viewers at home, that you can subscribe to the IEA's channel. We'll be putting out a lot of content during lockdown. Podcast content, IEA isolation like this, and many other pieces of video content as well. So do subscribe, and I'll see you next week. Cheers.